Video of the breast anatomy series, the nipple and the areola. What are the topics that we will cover? The nipple, the areola, and the soft tissue of the breast. Regarding the nipple, its location and its appearance. It projects from the center of the breast anteriorly, and it can be cylindrical, rounded, hemispherical, or flattened. It projects from the center of the breast anteriorly, and it can be cylindrical, rounded, hemispherical, or flattened. The shape and the size of the nipple. The shape and the size of the nipple is influenced by the developmental factors, nervous or hormonal factors, and the external temperature. The shape and the size is influenced by the developmental factors, nervous or hormonal factors, and the external temperature. The subareolar muscle contributes to the erectile properties. So, again, about the nipple, the location and appearance, it projects from the center of the breast anteriorly, and it can be cylindrical, it can be rounded or hemispherical and flattened. And the shape and the size is influenced by the developmental factors, the nervous or hormonal factors, and the external temperature. And the subareolar muscle, it contributes to the erectile properties. And regarding the position of the nipples. In females, it varies depending on the size and the shape of the breast. Typically, it's over the fourth intercostal space in younger women. In females, it varies depending on the size and the shape of the breast, but typically it's on the fourth intercostal space in young people. And in females, with age and parity, breast adopt a sagging shape. It sags down, and the nipple may drop down to the level of the inframammary crease or lower than that. And why? We will discuss this later. It is so in females, it can vary depending on the size and the shape of the breast, and typically it's over the fourth intercostal space. And with age and parity, it can drop down. It can cause a ptotic sagging shape. Now, in males, what's the position in the males? It is usually in the fourth intercostal space along the mid-clavicular line. It's located in the fourth intercostal space along the mid-clavicular line. In young adults in both sexes, the nipples typically 20 to 23 centimeter from the suprasternal notch in the mid-clavicular line. Nipple in young adults, it's typically 20 to 23 centimeters from the suprasternal notch in the mid-clavicular line, and the horizontal distance between them is 20 to 23, the same. Now, what are the developmental variations of the nipple? Now, we have discussed about location and appearance and the position in males and females and the developmental variations of the nipple. What's the color? In nulliparous women, those who have not given birth, the nipple color varies from pink to light brown or darker depending on overall body melanization. In nulliparous women, those who have not given birth, the nipple color varies from pink to light brown or darker depending on the overall body melanization. And the darkening occurs during pregnancy. Beginning around the second month of pregnancy, and persists to varying degrees afterwards. And what about the retracted nipples? Occasionally, the nipple remains retracted due to prenatal developmental variations. Occasionally, the nipple remains retracted due to prenatal developmental variations. So what will happen due to this? There will be feeding difficulties. Now, we have discussed about nipple, but we have discussed the location and appearance of it, the position of it, the developmental variations of it. Now, the areola. So what are the general characteristics of it? So the general characteristics are, it is the disc of skin surrounding the nipple. And it has a convoluted surface. Disc of skin surrounding the nipple. It has a convoluted surface. So, other than the general characteristics of the areola, there are glands in the nipple. in the areola glands, and there's skin and pigmentation in. So what about the glands? What about the glands of the areola? It contains numerous sweat and sebaceous glands. It contains numerous sweat and sebaceous glands. The sebaceous glands produce oily secretion. The sebaceous glands can produce an oily secretion which acts as what? A lubricant. And also what it does? It protects the nipple and it facilitates latching during lactation. Okay, again to that point. In the areola there are glands, and there are numerous sweat and sebaceous glands in the areola, and these sebaceous glands produce an oily substance. It's a secretion, and what do? They act as a lubricant, they protect the nipple and facilitate latching during lactation. What is the next part of the glands in the areola? There are Montgomery tubercles. What are they? They are specialized sebaceous glands in Paris women. Now, there are sebaceous glands, specialized ones. Okay, specialized sebaceous glands in Paris women. Montgomery tubercles. You have to remember them. They are major MCQ points. But they appear as small elevations around the areola. And what's the third point of the Montgomery tubercles? They're positioned near the margin of the areola. Again, regarding Montgomery tubercles in the areola glands, it's a specialized sebaceous glands in parasum. You have to remember that. Appear as small elevations around the areola and positioned near the margin of the areola, at the corner of it. And what are the other areolar glands? The other areolar glands, they are intermediate between mammary and sweat glands. They enlarge during pregnancy and lactation as subcutaneous tubercles. These other areolar glands, they enlarge during pregnancy as subcutaneous tubercles. And also there's another point regarding the sebaceous and sweat glands. The sebaceous glands are typically not associated with hair follicles in the areola. The sebaceous glands are typically not associated with hair follicles in areola. Now we have discussed about the glands in the areola. What about the skin and pigmentation? They are rich in melanocytes. Typically darker than surrounding breast skin. And darkens during the second month of pregnancy and may remain darker afterward. 3 points regarding the skin and pigmentation. They are rich in melanocytes. They are typically darker than the surrounding breast skin and darkens during the second month of pregnancy and may remain darker afterwards. Now we have covered that part of the areola. Then we move on to the soft tissue of the breast. So think about this. Regarding the soft tissue, there are few points that we have to cover. First one is the composition of the breast. Then the connective tissue stroma. Then the fibrous tissue and the ligaments and the adipose tissue. Let's move on to the composition of the breast. It has lobes. Those lobes made up of what? The breast contains lobes made up of glandular tissue network with the branching ducts. And terminal secretory lobules. Again, we'll go to the beginning. Regarding the composition of the breast, it has lobes, and these lobes are made up of glandular tissue, which has a network with the branching ducts, and it has terminal secretory lobules. Got it? Next one. There are terminal duct lobular unit, TDLU. What does that do? It's the functional milk producing unit. So terminal duct lobular unit, it's the functional milk producing unit. It's a common site for primary breast cancellations. Terminal duct lobular unit is the common site for primary breast cancellations. You have to remember that about the lobes. So there are 2 points. It contains of lobes, which has glandular tissue, and terminal secretory lobes. And there's terminal duct lobular unit, which is the functional milk producing unit, and it is the common site for primary breast cancer lesions. And next one, the composition of the breast. The next part is the intertwined lobes. All the lobes are described as discrete. They intertwine in 3 dimensions, merge at the edges, making them indistinguishable in surgery. In surgery, you can't see them separately. They're intertwined. They're intertwined in the 3 dimension. Now, we have discussed about the composition of the breast. Now, the connective tissue stroma. Connective tissue stroma has surrounding lobes and intralobular connective tissue. Those surrounding lobes are dense fibrocollagenous connective tissue, surrounds the lobules. What is surrounding lobules? Dense fibrocollagenous connective tissue, which surrounds the lobules. Then what's the intralobular connective tissue? That's loose texture, allowing rapid expansion of the secretory tissue during pregnancy. Again, we'll go back to the beginning. We discussed about the composition of the breast. We discussed about lobes and the intertwined lobes. Now, what's the connective tissue stroma? It has surrounding lobes and intralobular connective tissue. But what is more dense? That's surrounding lobes. That's fibrocollagenous. Intralobular, that's loose, allowing rapid expansion. For what? During pregnancy. Why? The secretory tissue develops during that. There's surrounding lobes, there's intralobular connective tissue. Remember those 2 parts. Now, the next point regarding the soft tissue, there's fibrous tissue and ligaments. The main ones are the suspensory ligaments of Ashley Cooper. Cooper's ligaments, we call them Cooper's ligaments. The fibrous bands connective tissue. It extends from deep fascia over the anterior tissue, chest muscles to the skin and dermis. It extends from the deep fascia over the anterior chest muscles to the skin and dermis. And it is well developed in the upper part of the breast. And it supports the breast and help maintain its non-ptotic shape. And we discussed this before. We told about this. The ptotic shape, it happens when the patient ages. Okay. Now the suspensory ligaments of Cooper is very important. Next part. In the other parts of the breast, fibrous tissue surrounds the glandular components. And what does those things do? They extend to skin and the nipple, maintaining the mechanical structure of the gland. So, regarding fibrous tissue and ligaments in the breast, there's suspensory ligaments of Ashley Cooper. They're the fibrous bands. They extend from deep fascia to anterior chest muscles and to the skin and dermis, and it's well developed in the upper part. What about the other fibrous tissue? There's in the elder sphere. They're on the other parts of the glandular components. It surrounds it. What does it do? It maintains the mechanical structure of the gland. Just the next part, the adipose tissue. Well, what does it do? It's found in the interlobar stroma between lobes. The adipose tissue makes the matrix found in the interlobar stroma between lobes. And it contributes to the breast size, especially during puberty, due to the accumulation of fat. So the breast size is mainly by the accumulation of fat, the adipose tissue. Now we have discussed about all 4 parts of the nipple and areola. We'll see you in the next video. Thank you very much.